Hello guys, welcome to my channel. And today I'm going to talk about beta adrenergic antagonist. Okay. So let's divide beta adrenergic antagonists into beta 1 selective and beta 2 selective adrenergic antagonist, and there is also the non-selective adrenergic antagonist. Okay, so what are the beta 1 selective adrenergic antagonists? So uh, to remember, we will remember a mnemonic, right? Like A to M. Okay, so the drugs starting with A to the letter M is selective beta adrenergic antagonist, like atenolol, metoprolol, bisoprolol. Okay, and for non-selective beta adrenergic antagonists, we will remember that the drugs starting with the letter N to the Z, like nadolol, like oxprenolol, propanolol, timolol, are the non-selective beta adrenergic antagonist. Okay, and for beta 2 adrenergic antagonist, we will see that there is a drug called butaxolol, butaxamine. Butoxamine is the beta 2 selective antagonist, but we don't really use beta 2 selective antagonist, so we can skip it. Then there is the drugs that act on alpha and beta receptor, like they block alpha receptor and also the beta receptor. Okay, so alpha and beta antagonists can be remembered that they have the suffix. Okay, they have the suffix -ylol or -alol. Okay, like labetalol and carvedilol. Okay, there is another beta antagonist called nebivolol. It has some special property that it is beta 1 blocking property. It has the beta 1 blocking property, and it stimulates beta 3 receptor. Okay, and by stimulating beta 3 receptor, it releases nitric oxide. So what are the pharmacological effects of beta adrenergic antagonist? We will discuss the non-selective and the beta 1 selective. Okay, let's talk about it. In cardiovascular system, we will see that beta adrenergic antagonist decreases the heart rate. It will produce the effects just opposite to the beta agonist, right? So it decreases the heart rate, it decreases the force of contraction, so is the negative chronotropic effect, and it has the negative inotropic effect. Okay, it has also the negative dromotropic effect, because it decreases the AV conduction. Okay, slows the AV conduction. Then if we see in the respiratory tract, it has the beta 2 blocking action. Okay, because the non-selective drugs are the beta 2 blocking action, they causes bronchoconstriction. They causes bronchoconstriction and exacerbates the asthma. Okay, exacerbates the asthma. So it is contraindicated to asthma and COPD patients. The beta receptor and antagonist drugs are contraindicated to asthma and COPD patient. Though we can use the beta 1 selective, but you can say that we can use beta 1 selective drugs because it has no beta 2 blocking property. Uh, but no beta 1 selective drug currently available are purely beta 1 selective. So no, the drugs we currently have, like beta 1 selective drugs we currently have, are not purely beta 1 selective. So they have some effect on beta 2 receptor, and so that we should avoid these drugs on avoid these drugs on asthma or COPD patients. Okay, what about the effects on the eye? So let's talk about the effects on the eye. So the beta 1 select beta selective beta adrenergic antagonists or non-selective beta adrenergic antagonists are used in glaucoma, where there is increased intraocular pressure. They decreases the intraocular pressure, like beta adrenergic antagonist decreases the intraocular pressure. So how they decreases the intraocular pressure? Okay, intraocular pressure can be decreased by two mechanisms: by increasing the drainage of aqueous humor or decreasing the production of aqueous humor. Okay, so beta receptor antagonist drug decreases the production of aqueous humor from the ciliary bodies. Okay, from the ciliary bodies in our eyes in produce the aqueous humor, so it decreases the aqueous humor production from the ciliary bodies, and this decreases the intraocular pressure. Here the drug we used is called timolol mainly. So why the timolol is used in the glaucoma? Because it lacks the membrane stabilizing property. Membrane stabilizing property. As you can see, the other non-selective beta antagonists have this membrane stabilizing property or local anesthetic property. Membrane stabilizing property, because they block sodium channel. Okay, by blocking the sodium channel, they act as they have some local anesthetic like property, and they have this membrane stabilizing property, but timolol lacks this property, and that's why we use timolol topically on the eye to decrease the intraocular pressure, and so that we use it in glaucoma. Okay, so what are the metabolic and endocrine effects? Let's see. By beta 2 blocking action, it decreases the gluconeogenesis. It decreases the glycogenolysis. Okay, it decreases the glycogenolysis, and so that causing hypoglycemia. By blocking the beta 1 receptor, it also masks the effects of hypoglycemia. Okay, So it masks the effects of hypoglycemia. So it is contraindicated, or beta adrenergic antagonists are contraindicated to diabetic patients who are taking diabetic patients who are taking insulin or oral anti-diabetic drug. Okay, because it masks the effects of hypoglycemia. So, and it also increases the chance of hypoglycemia. It increases the chance of hypoglycemia, and it masks the effects of hypoglycemia like tachycardia, palpitation, right? By masking these effects, it will delay the diagnosis of hypoglycemia and it will lead to the death of the diabetic patient. That's why we will not use, or we should not use, the beta adrenergic antagonist in diabetic patients who are on insulin or oral antidiabetic drugs. Okay. In chronic use of beta adrenergic agonist, we see that there is increase in the VLDL and there is decrease in the HDL. Okay, and this increases the cardiovascular disease, increases the risk of cardiovascular disease. Okay, but the drugs like penbutolol, sorry, yes, now, okay, yeah, the drugs like pindolol, acebutolol, penbutolol, cartiolol, oxprenolol, these drugs have this intrinsic sympathomimetic activity. They have intrinsic sympathomimetic activity. Means they are partial beta agonist. Okay, beta agonist. And so these drugs have less effect on plasma lipid profile. Now let's talk about the uses of the beta adrenergic antagonist. We have already talked about we use it in glaucoma. The drug we use is called timolol. In hypertension, we use beta adrenergic antagonist. Though it is used as the fourth line drug in this hypertension. And nowadays it is losing its we can say that popularity as an antihypertensive drug. But how they actually decreases the blood pressure, we have to know that how it decreases the blood pressure. And acting on heart, we know that it decreases the heart rate, it decreases the force of contraction, and by this it decreases the cardiac output. And by decreasing the cardiac output, it decreases the systolic blood pressure, right? Okay. And acting on the kidney, it blocks the beta 1 receptor in the juxtaglomerular apparatus and decreases the renin secretion from the juxtaglomerular apparatus, and this decreases the sodium and water retention. So we know that we know that renin increases the sodium and water retention. So by decreasing the renin, we decrease that it decreases the sodium and water retention, and it decreases the blood volume, and it will decrease the venous return, and thus decreases the cardiac output and decreases the blood pressure. Okay, it has effects on the nerve ending. In nerve ending, it decreases the noradrenaline release, and also in the central nervous system, it decreases the noradrenaline release, and noradrenaline increases the blood pressure by constricting the blood vessels. So by decreasing the noradrenaline release, it decreases the blood pressure. Okay, it's also used in migraine, though the mechanism is not clear. This we can use beta adrenergic antagonist in the migraine. Then it is used as anti-anginal drug. Anti-anginal drug. So by decreasing by antagonizing the beta 1 receptor, it decreases the force of contraction and it decreases the workload on the heart. Okay, by decreasing the workload, it will decrease the oxygen demand of the heart. So when the oxygen demand is decreased, it prevents myocardial infarction. So in angina, we can use the beta adrenergic antagonist to prevent the myocardial infarction and further worsening of the angina. And it is also used in the heart failure. It has proven that if the patient can tolerate the beta adrenergic antagonist, sometimes beta adrenergic antagonist can worsen the congestive heart failure, but if the patient can tolerate the beta adrenergic antagonist, it decreases the mortality in chronic use. Okay, in chronic use of beta adrenergic antagonist, we can decrease the mortality in the patients of heart failure. Though the mechanism in the heart failure is unclear, but it has suggested that it decreases the remodeling of heart, and it also decreases the apoptosis of myocytes, of cardiac myocytes. We can also use beta adrenergic antagonist in arrhythmia. The drug we use, the drug has the spatial ability, like ion channel blocking ability, is sotalol. This drug can block the beta receptor, and also it has the ion channel blocking property. It can be also used in anxiety, tremor, like essential tremors, and in hyperthyroidism. In hyperthyroidism, it decreases the tachycardia or heart rate, palpitation, and decreases the anxiety. Okay. We also use beta adrenergic antagonists in pheochromocytoma, and the drug of choice is labetalol. What are the side effects of beta adrenergic antagonist? Let's see that the side effects, it can exacerbate asthma. Okay, it can cause bradycardia, or you can say sinus bradycardia. It worsens the heart block because it decreases the by slowing the AV conduction, right? When I slow the AV conduction, the heart block will be worsened. It can worsen the peripheral vascular disease because by blocking the beta 2 adrenergic receptor, but the alpha receptor in the blood vessels will dominate and it will constrict the blood vessels, so it will decreases the blood flow into the peripheral tissues, and it will worsen the peripheral vascular disease. Okay, 5, it is going to do hypoglycemia, and it is contraindicated to diabetes mellitus. We have talked about it earlier. It can do fatigue, it can do depression, and also sexual dysfunction. It increases the level of VLDL and decreases the level of HDL, so increases the risk of cardiovascular disease and acute withdrawal. If I acutely withdraw the beta adrenergic antagonist, so if a person is chronically using the beta adrenergic antagonist and suddenly withdraw the drug, he can suffer from tachycardia, even he can suffer from ischemic heart disease. Why this happens? Because if the person is chronically using the beta adrenergic antagonist, there will be beta receptor upregulation on heart. Okay, so sudden withdrawal will cause more sympathetic stimulation, like more noradrenaline, and adrenaline will bind with more beta receptors, and that this will lead to increase in the heart rate and increase in the force of contraction, and this will lead to tachycardia and even ischemic heart disease. Okay,